Well, welcome everybody. Thanks for being here for this webinar from Pinnacle Health Informatics. I'm Ginger Bandine. I'm the Director of Clinical Data and Analytics for Pinnacle. And we're here to talk a little bit today about box and whisker charts, and I'm going to let the rest of the team introduce themselves. Go ahead, Sean.
Thanks, Ginger. This is Sean Fraser here at Pinnacle Health Informatics. Thank you, everybody, for attending today. We're very excited to talk about today's subject, and we've got a lot of good content. We're going to look at data variability using this tool, and I think you're going to enjoy what we have to present, so thank you.
All right, and Gary?
Welcome, everybody. We're glad you're here today, and thank you, Sean, for putting this together, Sean and Ginger. These type of charts are something that I've been wanting to use in our data for many, many years. They're used quite a bit in the stock market and watching stock values, and I think we found some excellent places to use them in the behavioral healthcare space.
Today we wanted to talk a little bit about data visualization and a concept that we think is pretty interesting and revealing about patterns in the data. And we want to talk about variability in the data. A lot of times clients say, hey, I want to see a graph of some measure over time. And so we'll do a line graph, right? And we'll see how client encounters or provider hours or some value goes up and down. And we've all seen those kind of line charts like that. But what they don't reveal is kind of the variability of the data. So the data is going up and down, but what does the data really look like, and how is it distributed? And so one thing we wanted to look at today was a distribution visualization, and I've got one up on my screen here, and hopefully everybody can see it. And it's a pretty simple one, but it's going to be the basis of what we're going to discuss today. And it's called a box and whisker or a box plot. And basically we're looking for kind of the center of the distribution, right? In most distributions, that's where the bulk of the data lives, right? So if we have kind of a bell curve of information, if we look at the center of that distribution, we're going to see where the bulk of our data lies. And so here in this image, it's represented by this box, this square box. And what it represents is the 75th percentile of the range of values down to the 25th percentile in our range of values. And that represents the bulk of our data, right? 50% of our data and where that lives. Now, the other thing we're going to talk about today is the mean and the median. And you may remember from your statistics classes, the mean is the average, right? You take all the values and you sum them up and then you divide and you get the mean, right? But the mean can often be skewed by outliers, right? So if you have some very high values or very low values, that mean or that average can get skewed, and so it's not really necessarily a good measure. And so the median, the 50th percentile value, so 50% of the values are above the median and 50% are below the median. And that gives us a value that gives us a better sense, I think, of where the middle of the data is. And that would be the median. But we also have outliers, so we have high values and we have low values, and we're able to show all these different values on the box plot or the box and whisker chart by using the tips of these extensions here. And then the one we're going to show you, we'll actually put a little line on the top to show our high values. So we're going to be able to show for each category. So whether that be by month or by program or by provider, we want to be able to show the range and variability, and we can show that things get better over time, perhaps, if we're looking at the data in that way, or getting worse, or things are going in some certain trend. So that's kind of an overview of a box plot and a box and whisker chart. Let me talk a little bit about how we get this data, okay? Because we have to be able to get this data in a form that allows us to break it out into these what we call quantiles, right? And so I'm just going to show really quick a little bit of SQL code. It's just I just kind of wanted to show a little bit, and I won't go too deep into it. But there are some functions in SQL that allow us to look at a data set and look at these things like max value, min value, average, the 25th percentile, the 75th percentile, the 50th percentile, etc. And so it's a function. It's only about 15, 16 lines or something like that. But if we prep our data correctly, then we can easily kind of break our data out into these values. Okay, and so using a function like this, and that's all I'll really say about that, we can then start preparing some charts. And let me show a box plot here on our screen here for the first time, and we can start talking about that. So what this is we have some data from one of our clients here, and it looks at length of stay, okay? And they want to break out length of stay by date and also by program. And so let me pull up one that's maybe a little bit simpler here. Here we go. So here we have an example of a box plot that's simple, and it's a length of stay for a methadone program, and it's an aggregation of the last 12 months, and then it's broken out by program. And so you can see here that we have our outlier values. So our minimum on this, in this case, is 0, but our maximum in days is well over 2,000. And I have a little mouse over here that we can look at. Let me pull that up, and I'll leave that on the screen here. So you can see that the 75th percentile is 767. The mean is, let me pull that up, 544. The median is 294. The 20th percentile, or the 25th percentile, is 77, and the minimum is 1 day. So we can see where the bulk of the data lives. So the 50th, the 50 percentile, or the 75th to the 25th percentile is this green box. But we also see that the mean is 544 days, and it gets skewed a little bit by this high outlier value of 2,200 days. But the median is a more true measure, which is this dotted line, which shows us where the values kind of are distributed a little bit more accurately. It's at 294. So 50% of the values live above and below this dotted line. So it gives you an idea about variability in your data and how that's performing. We can look at a little bit different one here, and here we're looking at it with some colors by program by month. And so now we're kind of looking at a time frame, and so you can get a sense of, things are kind of getting longer as the year progresses in our data variability, because we're getting these long spread out bands with a median and a mean that are increasing as we go along. And so you can kind of see how the data is a little more meaningful as we give it some context as far as variability goes here and by program. We can do a lot of interesting things with this, as you can probably imagine, but it does really help us to see and help you see, if you adopt things like this, kind of the way the data is spread out, and help you identify outliers, help you look at your averages and and your means and your medians, and see the direction your data is moving.
So when Sean was talking about that, and showed me that, and we were talking about this measure, this way of visualizing the data, it made me think about how could we apply that in behavioral health? Because one of the things I think makes our data especially hard to analyze is the variability of it. That, you have one or two services that are three days long, and now all your services, it's hard to figure out what the average is, or where are they located, or like where the data is really at the middle part of the data. And so I just thought of some examples, and I thought I'd show you guys some examples of how you might use this visualization to understand some of your data. So I made this quick one, and just FYI, you guys know me, I'm a clinician and a little bit of a technical person, but it's not really that hard to kind of modify that script that Sean showed us to use it for different things, and that's something we'd be happy to help you guys with too. So it didn't really take me that long, and I thought, well, let's just compare how long a typical service is depending on what type of service it is. So that's what this chart is. So what I did is I just said, find the duration of every service of these different four different kinds of service, and then plot them out using this visualization. So you can see, and so this is by number of minutes. So in this example, group therapy is up a little bit. Most of the group therapy at this agency is longer than most of the individual therapy sessions. So see how the black is longer. It's closer to a 90-minute group therapy session, which makes sense, right? A lot of groups are 90 minutes versus most individual therapy is 60 minutes. And then if you look at individual activity therapy, that tends to be a little bit more spread out. There's a little more variation, and there's a lot more of it that's less than an hour. So if you look at the mean and the median, both show that it's lower, but you can definitely tell that more than half of it is less than the average individual therapy. And then with crisis with therapy, it tends to be a little longer than individual therapy. So that's just one example of what you could do. What I thought would be really interesting would be to see that across providers. So then I was like, okay, well, let's just look at individual therapy and let's see what the variation is across providers. So this is all the providers in a particular agency, and this green line is 60 minutes because we know most therapy tends to run around 60 minutes, right? But it's really interesting to look at this because if I just found the average for all these providers, they would all all of the little average lines are kind of close to 60. But if you really look at these boxes, you can see there's a lot more variation than you would initially think. Like, for example, this provider tends to have a whole bunch of variety of times of an individual therapy session, right? Like this 50% of their individual therapy sessions are in between, let's say that's probably about 50 minutes all the way down to like 8 minutes. So that's really interesting. It might be interesting to go look and see if there's a pattern with that provider. Here's another provider that kind of has that pattern. Here's a provider where most of their individual therapy is more than 60 minutes, which is really unusual. You can see almost everybody hovers right around 60 minutes. So you can see for this provider, almost all their sessions go closer to 90 minutes. And so when you get into this kind of detail, you can really start seeing patterns across providers. You can also see providers who, we all know, sometimes folks just get in the habit of clicking the start and end time to be exactly on the hour. And so you can see some people just have a line right at 60 minutes. Every single session they do is exactly 60 minutes long. And that might be a pattern you would want to address. In some states, that's kind of an audit issue if you have every session looking exactly the same. Well, we'll go on to the next one. So this is just looking at patterns around how long services are lasting, right? And you could do this, you could have a parameter up here where you pick different services. It really, right now I just have this pulling individual therapy, but you could do group therapy. How long do you could do case management, you could do med management, perhaps assessment. So you could really start to see patterns of practice across. You could divide this up by program. You could divide it up by, you could see trends over time. So you could look at a particular provider and show trends over time. So then I was thinking about, well, what's another cool thing we could do? Because one of the things I think about a lot is, what's the data we already have in our system that we could get more value out of without asking therapists or counselors or case managers or staff to do more data entry? So they're already entering some of this data. How can we make better use of it? So then I was thinking about counts of services. So like utilization, like how frequently are individuals receiving services from us? How many services are they getting? And so I just built a couple examples of where I added up how many services individuals were receiving in a year. And then I just broke it out by program and then, it was by month. So how many, you're not a typical client, but for all the individuals who receive services in a month, how many services did each of those individuals receive? And then I broke it out by program and then by month. So for example, these numbers represent programs. So in this program, for example, over time, the individuals were receiving probably between like 5, and this goes all the way up to, this is actually a logarithmic scale, so maybe up to 20 services in a month. And then over time, you can kind of see some variation. There was a period of time where more people were getting quite a few services. And then there was a time where people, so this hasn't varied a ton, but you can really see interesting things if you look at program number 7. Like things there have really varied over time. So it would be really interesting to know, there's probably some policy changes that were made, perhaps how things were being documented changed. Or if you look over here at program 8, you can see that things went up for a while where more people were getting more services. Then things kind of fell down a little bit. Then things went back up. And then now most people are getting right around, this is probably about 6 or 7 services in a year. Or sorry, in a month. And then down, so anyway, and then you can see variations across programs, which I think is really interesting, especially if you had multiple programs in like different locations, you could see patterns of use across locations. And then I have one more here, and this is even more broad. This is just across all the programs. So I was just pointing out that you could have a more simple graph that just is, for example, like 1 month at a time, but across your programs, or you could do it the opposite way. You could do all your programs in a given month, or all your months for a given program. That's what I was trying to say. Some other ideas I thought of with count of services is you could do that by diagnosis categories, so that you could see if there were patterns. Another thing that count of services could be useful for is for identifying individuals who are maybe your highest utilizers of services. So these tails that go way out here, you can put some drill downs in and just say, okay, who are the folks that are in this top percent here? It may not be very many individuals, but it may be really skewing, your data may be really skewed by those numbers. So, and same with individuals who are getting very few services. That's also interesting. Like down here, almost everybody got just a few services.
Ginger, I have a couple of others. These are some box plots to chart engagement variability, is what we would call it. And these are in production. They've been in production for a couple of years and have had a pretty serious and substantial impact on what's being measured here. And we can see here that these are days from intended initial assessment to the first service, right? And so you can see here, and I've put these as labels instead of as a mouse over to make it a little bit easier to see. But you can see here that, for July 2018, we had some outliers up to 73 days. Our median was 13.5 days. You can see that's come down a little bit, 11 days, even though the variability increased in August, but then it came back down. I mean, you kind of see over time. And for December, it was pretty good. The median was down to 7 days. And so you can get a sense of not just kind of the middle of the curve, but you can get a sense of the variability. And so in their case, they want to see that spread decrease, and they want to see the median go down. You can see in December it was quite good. And then we do it again for days from first service to second service. And you can see that that's also been decreasing over the year. At least the variability has been decreasing, and the median and the mean are fairly, looks like they're fairly constant. You can kind of see how that can be tracked.
Yeah, and as things kind of squish, that kind of shows you, if you're implementing a new system where you're trying to have people do things kind of consistently, you would hope to see that kind of squish, that box, right, as you implemented a policy. So for any particular thing, if you were implementing a policy like we want to have more consistency, you would see that box kind of squish.
Yep, and they monitor these very closely at this agency, and they're very attuned to how these numbers fluctuate. They watch them very closely, and they have some standards that they like to apply to the variability in the data. And this tells a lot more than just a line chart. We could do a line chart of the average, but this box plot, or this box and whisker chart, gives us a lot better idea about the variability of the data.
Thanks, Sean. Thank you so much for joining us for today's webinar. If you'd like more information, please contact Pinnacle Health Informatics at info@phidw.com or at 971-409-6931. Thank you.